Story time for my vaginismus girlies. Hey, I'm Dr. Darshana. I'm a pelvic PT. I treat vaginismus. I wrote a book about vaginismus. I gave a TED talk about vaginismus. So listen up. This week, I had a patient who said these exact words. I know what you think, but I'm not damaged. I don't know why this is happening to me. That question was not asked. I never asked, are you damaged? So this answer was in response to, I asked for, is there any history of trauma in your life, right? And it's not uncommon that people get very defensive. And it's not uncommon that they get defensive because they generally have a pretty good life. They don't have a medical problem. There is no disease that they're dealing with. They love their partners. They have great parents. They didn't have any abuse. Okay, this is a problem that happens to people or women who've gone through trauma or assault or any physical injuries, right? I haven't had any of that. I'm normal. Like, I get regular periods. I'm fine. I'm healthy. I exercise. I have a job. I love my parents. I love my spouse, all of that jazz, which then throws people in for a loop because the human tendency is, I want to know the root cause. I want to know why I'm having pelvic pain, why penetration is so hard, right? So not finding that problem makes people immediately feel very discouraged, because if you find the problem, then you know how to fix it, right? And then we talked at length, and I could just tell that she generally has had a good life, or so she thinks. And here's what I mean by that. Loves her parents, but when she was very little, her parents lived in a different country and she stayed back with her grandparents, because where her parents lived at the time, just there weren't good opportunities for schooling, and the best decision for their family at the time was that she stays back with her grandparents. And she did. She loved her grandparents. Grandparents loved her. Parents visited every year. That's what needed to happen. As a grown-ass adult, she understands what a big sacrifice it is for a parent to leave their child behind. She understands how difficult it is to be an immigrant and figure everything out. So she understands why her parents needed the family help for raising the child, right? Fast forward 8 years later, she had a little brother. The brother had some health issues for which he needed to be monitored or taken to the doctor frequently. Grandparents were a lot older by then and couldn't handle 2 kids, let alone like a little child who had extra health needs. So the brother stayed with the parents, and by then the parents had developed some level of ecosystem. It was very difficult to pull her out of her school because she was set, she had her friends. So she essentially stayed back with grandparents while her little brother got to stay with her parents. Again, very loved. Everybody missed her. They would visit. She would visit in summer breaks. The family there's just too much love around, is how she described, from grandparents, from parents, from everyone. Then time came for college, and she had just settled in a totally different ecosystem and didn't want to move. And eventually, as a grown-up, she moved closer to where her parents are, met her husband, got married, and never really lived at home other than that 1 year, right? And I was asking her, how was it? How did it feel to grow up away from your parents? And she just had such a hard time even saying the words out loud, that it was hard. It felt unfair. It sucked, while she understands where her parents came from and why they needed to do that. While she is grateful that her grandparents, her parents, her entire ecosystem just loved her a lot, she also felt like the 5-year, the 7, the 8-year-old her wanted to just be with her parents like her brother got to be, right? The 10-year-old her just wanted to be in every family picture that she received, right? And it's very difficult to call this trauma, because that in some cultures feels like you are accusing your parents, or you're being disrespectful, or you're not being grateful enough. So now you're dealt with these heavy feelings that you can't name them, because naming them the name feels you like you're a bad kid, or you're ungrateful, or you're disrespecting your parents. And yet the thing about feelings, my friend, is they need to be felt, right? If we just jump on to dealing with the problem and never really feel the feelings, what we see in human body is it would show up as anxiety. It would show up as jaw tension. It would show up as hip tightness. It would show up as vaginismus, penetrative pain, pelvic pain. It would show up as a bodily issue, because the thing is, we can pretend and lie to the whole world. We can even lie to ourselves, but our mind can never lie to our body. because your body is your only true home. And it's time that you listen to it. If you're clenching your teeth, if you need a night guard, if penetration is impossible even when you want it and you don't have any other medical problem that explains why, and if you've generally had a good life, I just want you to give yourself some grace. Sometimes life can be good and hard at the same time. And I see that many, many, many times in my vaginismus girlies who are generally doing well for themselves, have a loving ecosystem, and still have had some level of trauma that shows up as muscle tightness. If this helped, follow along, because all I talk about is the health of your holes and your whole health.